If you have failed USMLE multiple times and now you are running out of money as well to take the exams again and to apply for residency match, now you said, okay, I would like to now go for master's or PhD, but do you know you can still be a clinician in the US? Yes. Let me tell you some options. You can be a psychologist. If you wanted psychiatry, you can be a psychologist. You go through the same process after your doctorate, you go through residency, same process. So you will be a clinical psychologist. And in some states, I think New Mexico, psychologists can prescribe medication as well. What else you can do? You can actually be a nurse. Yes, a nurse are of different kinds. Here in the US, the nurses are not just women. Nurses can be anyone over here. It could be LVN, the first basic nursing degree is LVN, then you become an RN, registered nurse, and then there is an extra advanced level where you can prescribe medicine. Yes, you can prescribe medication. What is that called? That is called as NP, nurse practitioner. Yes, nurse practitioner makes a lot of money and can prescribe medicine or medication as well. Yes, they can prescribe drugs. So nurse practitioners are very, very powerful and they can be very rich. So it's not like India, Pakistan, or any other South Asian country like Bangladesh or Middle East where mostly nurses are females. No, nurses can be anyone over here. Okay, it's the US. And then what else you can do? You can be a respiratory therapist. Yes, respiratory therapist is a clinician. You will deal with the patients who have lung problems and you will be helping them with the breathing. So I am not that of a pulmonology guy, so I cannot tell you how they work, but I'm just telling you that I know respiratory therapists are there. And then what else you can do? You can be an occupational therapist. You can be a physical therapist. So there are so many options. Don't close your doors. And of course, all of these positions, you can do that. You can start doing this. And I would recommend start with a job, but you will be hired easily if you have something on your CV. So start to make your CV better and get some publications. That's where our program is. We will help you with research and publications, and then apply for positions as in academics or academia or research. So you can be a researcher right away and start making money. And with some money, you'll make a living. And with some money, you gradually pay the fee of the master's program. Yes, and then eventually, once you have become a clinician, you join that job, and you can take USMLE later because doctors are never old. Doctors keep studying for the rest of their lives. So what if you are a little late? First, establish your career as a clinician, make a lot of money, enjoy your life, and then later you take USMLE. I know people who have taken USMLEs in their 40s, in their 50s, in their 60s. So it can happen. So go ahead and do that.